In Europe, maybe MEP Papa, you can come in here. This seems really feasible. Why isn't it happening yet, you think?
Well, we don't have the health system doesn't necessarily take orders from the EU. Each country has to make its own decisions, especially on the pricing, and that's a very complicated thing. So, but we could set up standards. And one thing that you mentioned about not having a center, we have the ECDC, communicable diseases. How about NCDC? To have a center to propose for this, I think that one's not so hard to do. It's not hard to set up a new bureaucracy in Europe.
Because they're projected to skyrocket.
But that one's something that would give the center the research. So that would be very important. I really believe in bringing these tests to the people. So I did something called, I did on the liver in Piraeus, lower class area of Greece, poor people, a free fibroscan test, which is fatty liver test. It was voluntary, of course, so it wasn't like a statistical thing. About 300 people, of which 40% had serious problems, and they were all recommended to go to expertise. But then I wasn't a doctor. We weren't doing a study. I didn't follow their test. So for me, the urine test is important, and then the part 2. So and also what I forget your first name.
Daniel.
Daniel. What you said about the patient journey, as they say, that's an interesting word. In rare diseases, I don't know, you know better if there's protocols. You see this doctor, that doctor, if there's such a thing. So you don't go crazy trying to figure out your disease, who to see, who to call, what's your best friend. I think there's not enough information. That is something that the EU can easily provide. So there's lots of room for us here. As I say, the good news is we're on it. We started a little late, but I think that Europe itself is going to try to emphasize health more. My other concern is the things that lead to initial kidney problems, and that's our lifestyle, I think. And so when you talk about aging population, our lifestyle, which New Zealand has a Ministry of Healthy Aging, I think it's called. Very nice idea. And also retirement age, there's no retirement age if you don't want to retire. Healthy aging. I'm just saying there's ways for demography to take care of itself. In the special case, I'm hoping for the day where the dialysis machine would be like your cell phone. I'm just guessing in the future how that would be.
Professor Zadel, your response, I saw you.
No, yeah, I just would like to follow up on what you said about the standard, putting a standard. And I just want to follow up on one point. It's that, indeed, I think the wording of putting a standard is very important. And in that respect, what we learn from the literature in other fields is that if there is a mention of screening or systematic health check, those who would benefit most, because they are less favored culturally, socio-economically, so we know statistically their health will be somewhat less good, are those most likely to miss the test. So we should policymakers should think about how best to make it really systematic, because there will be more benefit from those systematic tests. And I'm not a policymaker, I'm happy to be a doctor. That's a key comment I wanted to make.
And a challenge for you there.
Yeah.